On behalf of NASH 24/7 team, I welcome all our viewers. Good afternoon, everybody. Today, we have leading gut and liver expert from Pune, Dr. Nisha Dhar Kapoor. Welcome, ma'am. Ma'am has rich experience of more than 18 years in the field of gastroenterology and hepatology. Dr. Kapoor has worked with Indian Armed Forces hospitals and other leading hospitals of country like Apollo Hospitals, Columbia Asia, and others. Dr. Nisha Kapoor was part of first liver transplant program in Eastern India and managed the first adult live donor liver transplant in Eastern India. Ma'am has authored numerous research articles in national and international journals and delivered award-winning oral and poster presentations. Thank you very much, ma'am, for sparing out your valuable time and to educate us on the fatty liver and lifestyle modification. Over to you, ma'am.
Thank you so much for the kind words. Let's get going with the topic now. So what I'm going to talk about today is to sensitize you all on the various lifestyle modifications which we need if we have fatty liver. So yeah, health is more than absence of disease. It is a state of physical, emotional, mental, and spiritual well-being, and not just the absence of disease. The idea of this talk is to sensitize you that fatty liver is a disease in itself, and it is preventable. We can prevent the onset of fatty liver as well as prevent the various manifestations of its progression, like non-alcoholic steatohepatitis, cirrhosis, and even liver cancer, if we are careful and we lead a healthy lifestyle. So why the liver? You see, the liver is like the kitchen of our body. Not only does it synthesize numerous number of proteins, it also helps in removing garbage from our body. And what is fatty liver? When there is accumulation of more than 5% of fat in the liver, then we say that fatty liver is present inside the person. Now, this could just be presence of fat inside the liver, or it could be an inflammation inside the liver, which is known as non-alcoholic steatohepatitis. And it is the current lifestyle which has led to a sudden boom in the urban world of the fatty liver. So how are we changing in lifestyle? You know, way back, if I had to purchase some kirane ka saman or some vegetables from the market, I would walk down to the market. But today, do I walk? Oh no. I take my scooty or I'll take my four-wheeler and I'll go down to purchase the things. So yeah, we are having a sedentary lifestyle coupled with high-fat diet, processed meals, ready-to-eat meals. And this is what is leading to the various lifestyle diseases in today's world. So 30% of urban world today is affected by non-alcoholic fatty liver disease, of which about 15% will go on to develop non-alcoholic steatohepatitis. So what causes the fatty liver? Fatty liver is a part and parcel of metabolic syndrome, which includes obesity, diabetes, hypertension, and dyslipidemia, or raised lipid levels. About 61% of deaths in India are due to non-communicable diseases. 1 in 4 people will have fatty liver. Every 6th Indian is diabetic. 20% of women, 18% of women will be overweight or obese. And more than 100 million Indians suffer from high blood pressure. The idea of showing you all these figures is to make you aware that how severe is the situation today of a disease which is totally preventable by having a healthier lifestyle. As Benjamin Franklin said, an ounce of prevention is worth a pound of cure. To win over lifestyle disorders, including NAFLD, what we need is a combination of dietary modifications, increased physical activity, and weight loss. So most of the studies across the world have seen that if we are able to lose 5 to 10% of our excess weight, we can prevent non-alcoholic steatohepatitis and progressive fibrosis from occurring in the liver. And that will help in normalization of our situation. It helps prevent the further onset of cirrhosis of liver and even liver cancer. So how do we maintain a sustained weight loss and lifestyle modification? Actually, it's pretty cheap to have a healthy lifestyle. All that you need to do is take from nature as nature made it. So try and minimize your processed meals. Anything which comes out of a tin or a can should be avoided, including sausages, salami. Cook your own meals as much as possible. Rely less on restaurant foods. Reduce your fat intake. It is better to stick to white meats, egg whites. But if you need to have meats, then always grill them. It's always much better to have grilled or steamed or broiled meats, because you can use lesser oils in cooking those meals. And also use of oils like olive, rapeseed oil, and flaxseed oil is much better as compared to mustard oil or peanut. Control your portions. The major part in your plate should be from vegetables, whole grains, and proteins. Fruits are a good option, but remember that fruits basically contain vitamins, sugar, and water. So you can't have unlimited amount of fruits out there, because basically it's just carbohydrates which you are having. Nuts are a good source of protein and they keep you full for longer. Especially walnuts are pretty good because they are also a good source of HDL, which are good fats. Drink a lot of water. It's well known that most of the times when we feel hungry, it's actually we are thirsty. We need water and not really food. So whenever you feel that urge to have more food, have a glass of water first, and then you have your meals, so that you can cut down on your meals. If you don't feel like having too much of water, you can have flavored water, like you can put some mint leaves in your water or cucumber slices in your water. It gives a nice refreshing taste to the water. It's easier to take it then. When we come to calorie restriction, it's very simple. You'll take out things from your storehouse only when things in your boxes are over, isn't it? So it's the same with the body. The body is going to take out from the stored fat only once you are having a calorie deficit diet. So if you need 2000 calories to survive for your day-to-day activities, if you have to lose your weight, you will have to consume less than that amount. And it has been shown in various studies that if you have a deficit of 500 to 1000 calories per day, then is when you are going to lose your weight. So what are the advantages of calorie restricted diet? You'll have a weight loss, you'll mobilize fat which is accumulated in the liver, and you will also improve other associated metabolic disorders like hyperlipidemia, heart diseases, your diabetes, everything will come under control. And as is general knowledge, Mediterranean diet kind of ticks all the charts out here, because it does involve usage of a lot of fresh fruits and vegetables and good oils and proteins. Exercise is very important, because though exercise will not help in overall weight loss, but it does help in mobilization of fat from the liver, thus decreasing the content of fat inside the liver and the inflammation thereof. Now, people often ask me, how much should I exercise? Well, most of the studies have said that you should do half an hour of exercise, any exercise, whatever you like. You like walking briskly, you can do that. You like jogging, it's fine. You like to do weight trainings, that's good too. So basically, you can't just keep sitting on your chair. You got to move. That is the most important thing. And you must exercise in accordance with your body type, as much as exertion as you can take. Slowly build up on your exercise quotient. It's always better to go slow. The way you have to reduce your weight is not to go on to a drastic diet, but lose between half a kilo to 1 kilo, maximum 1 kilo per week, not go more than that. So, and with that, I come to the end of my talk on the various lifestyle modifications. I hope that I have been of use to all of you out there, and I would welcome any questions. Over to you, Akash.
Yes, ma'am. Ma'am, thank you very much for the lucid and clear talk. Ma'am, there are a few questions from the viewers. Since you spoke on diet and sugar, Ma'am, one question is how to control sugar cravings while on diet. Is there? Yes, ma'am.
So the most important thing about sugar or carbohydrate is that it's better to avoid refined sugars, and you should go with complex sugars. Regarding the sweet tooth, a lot of people say that I have a sweet tooth and I really cannot avoid sweets. Well, there is no need to starve yourself completely. I would be with that as well, because most of the people who have NAFLD or NASH, they are people in their late 20s, early 30s. That is when they first find out that the liver has got more of fat. And I tell them that you can always have maybe a small piece of chocolate once in a week or something. Don't be very rigid on your diet. When we talk about diet, it should be a slow modification of your meals, reduction of your calories rather than a drastic change. Now, you tell a rice eater that you are going to now eat only jawar rotis for the rest of your life, I think it's a little bit more tougher to do that. But if you tell them that most of the days or most of the meals are going to be jawar atta, and you can have your rice intermittently, but in a reduced portion, it is easier to take it then.
Thank you, ma'am. Ma'am, does diet and exercise help in all stages of non-alcoholic fatty liver? Or
Well,
is it? Yes, ma'am.
diet and exercise helps in the NAFL stage, that is when there is excess of fat accumulated inside the liver. And it also helps in a non-alcoholic steatohepatitis state when there is increase of liver enzymes, but not excessive fibrosis. In that, it helps in mobilizing the fat, it decreases the inflammation, and the person can revert back to normal. However, it is also of help in cirrhosis, that is an advanced liver disease stage. Also, it helps because what happens with advanced liver disease is a loss of muscle protein. So when these people tend to go for exercises and when they go for a diet modification, taking a diet which is higher in protein, it does help in reducing the, as we call it, sarcopenia, or the loss of muscles, which can occur in progressive liver disease. So yes, overall, it does help us in all the aspects. Though of course, it completely can revert the situation in the NAFLD or the NASH stage. It really cannot revert the situation completely in cirrhosis stage, but it does give us a survival advantage.
Okay, ma'am. One question is there any medication for NASH and NAFLD?
Well, there are medicines which have now been recommended for NASH and NAFLD. And topping the list is our own drug from India, that is saroglitazar, which has been recently approved by FDA as a treatment for NASH. And several more drugs are also in the pipeline and are likely to come up by the end of the year or so, it is predicted. But so far, the lifestyle modifications still remain the banner flying high, as we say, for prevention of progression of liver disease as far as NASH is concerned.
Last couple of questions, maybe then in the interest of time, maybe take other one offline. One is, can fatty liver compromise my work productivity?
That's a very interesting question. Will fatty liver affect your work productivity? Well, probably directly it will not, because if we are talking just about a fatty liver and not a steatohepatitis, there is a difference between the two. A fatty liver means there is only excess of fat inside the liver, but the liver is quiet as such. I do the liver enzymes, it's normal. It doesn't really affect my day-to-day life as such. Associated issues because of fatty liver being a metabolic disease, that is diabetes, lipids, hypertension, they can make me fatigued. However, as the disease progresses and the next stage comes in, that is non-alcoholic steatohepatitis, then the quotient of fatigue does increase. And then your working capability will get affected as the liver disease will progress. Yes.
One question is, I have a big belly. I feel that it is because of fatty liver. And if I do lifestyle modification, then will it improve the chances of fatty liver getting cured?
Yes, absolutely. No doubts about it. However, you must understand one thing, that this is a metabolic issue. So we should rather think about control and not cure. While we will be preventing a progression of disease, the underlying risk factor always remains that if you do not, stick to the healthy lifestyle, sometime in your life, you're likely to develop further progression of the liver disease or further other metabolic disorders. So that means that your entire lifestyle, your entire life, you'll have to practice that healthy lifestyle. So that is something to understand, that it's controllable disease. We're talking about a prevention for the rest of your life. We are not talking about preventive measures for the next 6 months.
Last one. My FibroScan value is F3. Can liver detox and keto diet help me?
Wow. Well, F3 stage, if we say about FibroScan is very good when we talk about F1, F2 stages. When it comes to F3 and F4 predictions, then F4, while F4 is very clear that it is cirrhosis, F3 is a gray zone. So F3 means that there is significant fibrosis which is already there inside you. So, I mean, if some amount of regression of fibrosis will occur if you get on to the healthier lifestyle, if you start exercising and then you have a weight reduction, yes, some amount of regression of fibrosis will occur. And if it is already not touched the cirrhosis stage, yeah, I mean, there can be a regression of your disease.
Okay. Okay. Thank you, ma'am. Ma'am, one viewer has asked, my SGPT and SGOT levels, they remain elevated irrespective of what I do. So, and my body is lean. I don't have, I feel I don't have fatty liver. But when I met my physician, he told me I have. What is your take?
A lot of people do have what we call as lean NASH. And it's not that people who have obesity, only those people will have fatty liver. That is the general misconception which most of the people have. Okay, this person is fat, so obviously he will have fatty liver. No, it's not as simple as that. It's all about the fat metabolism, which is happening inside the liver. There are many reasons why a person will develop fatty liver. And it's not as simple as just obesity, which will cause fatty liver. And if the liver enzymes are increased and the ultrasound is showing fatty liver, then most likely the cause of your disease is non-alcoholic fatty liver disease only. That is if you're not an alcohol consumer. Obviously, there are many other causes also other than just fat deposition in the liver, which can give the appearance of fatty liver and have increase of the liver enzymes. But definitely you do need an evaluation, and it could very well just be non-alcoholic steatohepatitis, which is occurring inside you. You may need dietary restriction. Nevertheless, you may require exercise protocols. Nevertheless, even if you are lean, because that will help in removing the excess fat from the liver and sending it into the circulation to be used by the muscles and the brain. And you may even require pharmacological therapy.
Just the last one. I have grade 2 fatty liver. Do I fall in fibrosis stage or cirrhosis stage?
You have grade 2 fatty liver. Well, there's grade 1, 2, and 3 fatty liver, which the sonologists tell us on ultrasound. That is a visual idea which they are giving us. That what do they think is the extent of fat inside the liver? It has nothing to do with the functioning of the liver. So a person could be grade 3 fatty liver, and yet the liver enzymes will be absolutely normal, and the FibroScan report would be something like 4 or 5 kPas. And that's all right, So grade 2 fatty liver does not tell me regarding the functioning of the liver. It just tells me what does the liver look like in the mirror, so as to say. The further analysis of the liver then has to be done by liver function tests and by the FibroScan.
Okay, questions are pouring. I'll just take last couple. Does NAFLD patient should cut down the consumption of ghee completely?
Yes, ghee is also fat. So definitely, people often ask me, but is it not okay to take cow ghee? Maybe that is better. So I say, no, ghee is ghee. And since you have an issue and your liver is, liver itself makes cholesterol. That's why lean people can also have fatty liver disease. Even if you're not taking cholesterol from outside, the liver is also going to make cholesterol. So at least the least which we can do is not to provide further cholesterol into our body. And I think that works pretty well. So no, we don't need ghee to survive. We can always cut it from our diet if we have fatty liver.
Last one, ma'am. Any guidance on non-vegetarian diet since I am from North India and I eat non-veg, but I have heard that it has more fats.
No, in fact, all non-vegetarian diet does not have more fat. Red meat, which is mutton and pork, has a high amount of fats, and that should be avoided. But it is good to take chicken, and especially fish is very good. The method of cooking it has to be different. So you can take it in a roasted form or a grilled form or steamed form. That's perfectly fine. You just don't have to put too much of spices and oil and all that stuff in that, and that's pretty okay. In fact, it's good. It's better to take your meal like that. If one of the meals can be protein based and with a lot of vegetables, that makes more sense to get your carbohydrates from the vegetables rather than from roti and chawal if you're thinking of a weight loss.
Ma'am, thank you very, very much for answering all the questions and queries. There are a few more questions which I think will share with you offline. And ma'am, thank you for again sparing your valuable time out of your busy schedule and coming on to the NASH 24/7 page and guiding us on fatty liver and lifestyle modification. Have a
Thank
good day,
you
ma'am.
so much for this opportunity. I hope that it does help a lot of people to understand why they should have a healthier lifestyle. Okay, it's time to get up from our chairs and start walking, people. Thank you.
Thanks, doctor.